very happy to welcome you all on behalf of our organizing committee of the Department of Oral Medicine and Radiology to the CDE program. It is an opportunity to get knowledge and understanding. So we look forward to get an exposure about the alternate medicine for oral mucosal lesions. Now I request Dr. Sudhamani Ma'am, Professor, Department of Oral Medicine and Radiology, to introduce the guest speaker. Ma'am, it's over to you, ma'am.
Yes. A very good morning to one and all. With great immense pleasure, I'd like to introduce our guest speaker, Dr. Vandana. She is a professor at Indira Gandhi Institute of Dental Science, Pondicherry. She completed her BDS from College of Dental Science, Davangere in 2004 and MDS from Raja Mutaya Dental College and Hospital, Annamala University in 2011. She has an experience of 11 years in both UG and PG teaching. Her research thrust areas are on oral cancer and alternate medicine. She has 32 publications in both national and international journals. Added to her credit, she has authored a book on artificial intelligence in dentistry, and she has patented the topic on modified intraoral anti-gag films. She is currently pursuing her PhD at Sri Balaji Vidyabit University. Now I invite the star of our day, Dr. Vandana, to enlighten us with the topic on alternate medicine in oral mucosal lesions. Over to you, ma'am.
Very good morning to one and all. Am I audible? Is it clear?
Yes, ma'am. Yeah.
Thank you, Dr. Sudhamani, for a very short and crisp introduction. And I would like to mention that I was an external examiner last year for the postgraduates, and I had visited Vivekananda Dental College, and I was extremely happy with the hospitality and care given by Sudhamani Madam, Balan sir and her team. It's a fantastic college. We felt very, very happy and very warm. So once Babu sir and Sudhamani Madam asked for this, I immediately said yes, because I felt very warm and very nice. And with this brief introduction, today I would like to begin my day. It's my first guest lecture also, and so I'm very sentimental about it. And with the blessings of the Almighty and my grandmother, Srimati Rajalakshmi, who just passed away 2 years back, with the blessings of her and the Almighty, I would like to begin today's presentation. So,
With audio, ma'am.
you didn't get the audio?
Yeah.
You got the audio or not?
No, we didn't get the audio.
I am getting the audio. I don't know why the audio. Is it possible?
Yeah, wait a minute.
Yeah. Just check with your IT team, madam.
Ma'am, how about your network, ma'am? Actually, the video is also stuck for us.
No. Now I am going to play. I didn't play.
No. Previously also, the video is also not very.
You're not able to see the video?
Video we can able to see, ma'am, but not in a synchronized way. It is stuck in.
No. The video is not proper only. There is a little problem with the video, but at least something you can see.
Yeah, we can see, but we can't.
Audio?
Audio, no audio.
No audio. Okay.
Yeah.
I don't know what is the problem. Okay, it's okay, madam. We'll skip the slide. We'll not waste time on this. This is
Okay.
just this Surya's movie Yera Maribula. I would like to just mention that he is giving importance to alternate medicine, our traditional practices. That's all. So I just thought, it will be of use to the audience. So I played that. Anyway, we will go to the main topic, that is role of alternate medicine in management of oral mucosal lesions. Okay, that is the topic for the day. Okay, the video didn't play. It's okay. So we will move on to what are the specific learning objectives of this program. By this talk, for about maybe a 1 hour talk, I would like to emphasize what is alternate medicine, what are the common forms of alternate medicine which is used, and how useful this topic will be to develop interest among the postgraduates and undergraduates to take up projects in alternate medicine. What is the current evidence-based dentistry about alternate medicine? Role of alternate medicine in management of simple oral mucosal lesions. I'm sure all of you, all undergraduates, postgraduates, all of you are there. You all would have encountered some common chronic problems which are not able to be tackled by our traditional English medicine. I'm sure all of you will be agreeing with this with me. You will all be seeing cases of oral lichen planus, recurrent after stomatitis, which doesn't come down with our regular English or English medicine, okay, or allopathic medicine. So why don't we go back to our roots? Why don't we go back and see what we are going to learn from our forefathers? What we are going to learn, which is already there, practiced thousands and thousands of years ago. So this presentation in concise, it is going to tell you about that. So first and foremost is the introduction, which I already gave. Then we go into some common Indian medicines, which is aloe vera, curcumin, honey and propolis, chamomile, pomegranate, tea tree oil, ashwagandha, garlic and ginger. Okay. Now, the US National Center for Complementary Medicine, okay, they have recognized Indian system of medicine, and the US National Center for Complementary and Integrative Health of the National Institutes of Health states that complementary and alternate medicine, or CAM, is a group of diverse medical and healthcare systems, practices and products which are not generally considered part of conventional medicine. This is the definition for complementary and alternate medicine given by the US National Center for Complementary and Integrative Health. Okay, so now we have different classifications. First is manipulating the body. You have various therapies like chiropractic therapy, massage. This is one kind of a classification. Next is mind-body intervention. All of you know very well about yoga, spirituality, dhyanam, relaxation. All these fall under mind-body intervention. Next is alternative medical systems such as homeopathy, naturopathy, and Ayurveda. Okay. Next is energy therapies such as Reiki, magnets, and Qigong. Biologic-based therapies such as diets, herbs, and vitamins. And last but not the least is based on culture and origin, based on scientific beliefs, traditional ethnic systems, holistic therapy, supernatural energies, religion, faith, healing, and prayers. So these are the classifications of other systems of medicine. Okay. And now alternate medicine in mucosal lesions. So this presentation will encompass about aloe vera, honey, curcumin, chamomile, green tea, and coffee. Okay. First is aloe vera. All of you know, we have seen it in our kitchen gardens. Aloe vera is nothing but kattara. In Tamil, we call it as kattara. Okay. And it is very commonly grown in all houses, in all gardens. Okay. So it is belonging to a cactus-like plant family called Liliaceae. It is belonging to a family called as Liliaceae. Once you break that, you will have a slimy substance which is coming out. Okay. And it is called as kattara in Tamil. Some cosmetic and medicinal products are made from kattara leaf. Okay. And that aloe vera gel is very, very, very common. Okay. And this plant, what is the composition of this plant? This plant contains lectin. It contains glycoprotein, It contains lot of amino acids. Very, very important. It has got lot of amino acids. Vitamin C, E, minerals, superoxide dismutase, and anthraquinone. These are the things which are present in this kattaya. Okay, so all these components which are present in aloe vera have got a lot of medicinal properties. Okay, now this A vera or aloe vera has got anti-inflammatory action. How does it have anti-inflammatory action? How does it reduce anti-inflammation? It suppresses cyclooxygenase. All of you, I'm sure the undergraduates, postgraduates know that cyclooxygenase can cause or trigger inflammation. It is an enzyme which will trigger inflammation. So this will suppress the cyclooxygenase. Enzyme stop பண்ணிடும். Enzyme oda release in the aloe vera can stop. And it will give analgesic effect. Analgesic effect means it will say it will reduce the pain. It protects the liver and it has got anticoagulant and anti-carcinogenic effects. Okay, so these are the great properties of a simple plant called as aloe vera. Simple plant called as aloe vera. Okay. So it has got a lot of anti-inflammatory property, anti-cancer property, analgesic property. So where can we use this? So in the year 2017, in the journal Oral Diseases, I'm sure oral medicine postgraduates will all be reading this journal on oral diseases. Okay, so in this journal, we had a review article and a meta-analysis. They have conducted a systematic review and meta-analysis. Systematic review means it is the highest form of research. Meta-analysis is also highest form of research, where they're taking a number of randomized controlled trials and they're coming to a conclusion of whether this particular drug is useful or not. Such a way they have conducted in one of the very famous journals, nothing but Oral Diseases. I'm sure all the postgraduates will be knowing about this journal, Oral Diseases. It was published in 2017. A review article by S. Ali and Wahabi. Okay, the review article says efficacy of aloe vera in the management of oral lichen planus. So all of you are coming across oral lichen planus. Day in and day out, we're coming through oral lichen planus. Some patients are symptomatic. They say, ரொம்ப வாய் எரியுது மேடம், என்னால எதுவுமே சாப்பிட முடியல, எனக்கு வெறும் தயிர் சாதம் தான் சாப்பிட முடியும். Clear? Are you able to hear me, all of you? Somebody can unmute and interact, no issues.
Yes, ma'am.
It's fine. So you're able to hear.
Yes, ma'am.
Okay, good. So this is such a magic drug, and it is grown in our very own kitchen gardens. நம்ம சும்மா இப்படி ஒரு வாக் போனா பார்க்ல இருக்கும், but we will not realize the importance. Already systematic review has been done, meta-analysis has been done, and it has been shown that aloe vera is very, very efficient in the management of oral lichen planus. All of us do come across, especially oral physicians, oral diagnosticians. We are seeing so many cases of oral lichen planus. Immediately what we do, we will give triamcinolone acetonide. Ponga, இத போய் 10 நாள் போட்டுக்கங்க. 10 days later, patient will come. கொஞ்சம் குறைஞ்சிருக்கு madam. You take visual analog scale. You monitor the pain. You monitor the burning sensation. Document it. Document whatever you do. Document it. Patient will say கொஞ்சம் குறைஞ்சிருக்கு madam. ஆனா பாத்தீங்கன்னா ஒரு 3 months 4 monthsல lichen planus போயிடும். But what will remain? Can anybody answer? Any postgraduate oral medicine, can you answer? What will happen? Lichen planus will go off. What will stay back? Anybody?
Inflammatory pigmentation, ma'am.
Very good, very good. Inflammatory pigmentation, also called as lichen planus pigmentosa. வாயை பாத்தீங்கன்னா கருப்பா இருக்கும். கரி நாக்குன்றது வேற. நீங்க சொன்னா வார்த்தை பலிக்குது அப்படின்றது கரி நாக்கு. இது வாயே கருப்பா போயிடும். Yes or no? Okay. Patient will come, madam. இங்கெல்லாம் கருப்பாயிடுச்சு madam. முன்ன வெள்ளையா இருந்தது இப்ப கருப்பாயிடுச்சு. Because that is the side effect of all steroids, topical steroids, systemic steroids. They cause oral pigmentation. So do you want something alternate? Do you want something natural? Do you want something without any side effects? Yes. Yes. We want something without any side effects. We want something to cure the patient without any side effects or minimal side effects. And hence we have come across aloe vera. We have come across aloe vera. So aloe vera is some magic herb. Okay, and we have got a evidence base. That is why I put in my specific learning objectives that we will go through certain evidence-based conditions. So we have got review and systematic review and meta-analysis which says that efficacy of aloe vera in management of oral lichen planus. Okay, so we do use aloe vera, and aloe vera has shown some great benefits in the management of lichen planus. Okay, so you can take note, postgraduates can take note of the article, the year, issue, and you can go and read. And it has been, I don't want to go into the details of how the search was done. All of you know systematic review, you search through various databases like your Medline, Cochrane, etc., etc. And they have concluded that there are no side effects or very, very minimal adverse effects when compared to corticosteroids. Because all of us know corticosteroids are the standard drug for any inflammatory condition such as lichen planus, etc. So one condition is using aloe vera to reduce the effects of lichen planus. Now we have another review article which says that aloe vera in treatment of oral submucous fibrosis. Here also there is inflammation. That is why you're going to give intralesional steroids. Yes or no? You're going to give intralesional steroids. All of you are giving intralesional steroids, correct? So there is a systematic review and a meta-analysis, which is again a highest form of research, where they have proved that aloe vera is used in the treatment of oral submucous fibrosis. There have seen improvement in mouth opening. There have been incidences where there is increase or improvement in mouth opening in patients suffering from oral submucous fibrosis. How does aloe vera act? It has got anti-inflammatory properties similar to steroids. Okay, and the abstract of the article says they have conducted 6 randomized controlled trials which fulfilled the inclusion and exclusion criteria, and aloe vera has promising effect in reducing burning sensation and clinical improvement, that is mouth improvement, in patients with oral submucous fibrosis. Okay, so this is something with aloe vera. Now we are going to recurrent aphthous. Now after this lichen planus and all those conditions, another chronic condition which will irritate all or which poses a great diagnostic challenge. And most of us physicians, we are not very happy, isn't it? Our patients are telling, madam, it is resolving, but again it is coming. Then again it is resolving, again it is coming. I'm not able to study. I'm not able to work. I'm not able to eat something nice. I'm not able to eat something spicy. So this is a common complaint of our patients. Okay, so we keep getting patients again and again and again. And that another condition is recurrent aphthous stomatitis. All of you must have experienced, isn't it? During your exam times, MDS examinations, BDS examinations, stress levels are high. You're faced with recurrent aphthous stomatitis. Okay, yes or no? You can unmute and interact. Only then it will be a two-way conversation. UGs, PGs, everybody can unmute and interact.
Yes, ma'am.
Is it clear? You
Yes,
have seen cases of recurrent aphthous stomatitis?
Yes, ma'am. During exams, it is very frequent.
It is very frequent. Good. So you see how distressed the patients are. Yes or no?
Yes, ma'am.
So patients are very upset. Patients are very, they're very apprehensive, because this can also induce something called as cancerophobia. They get scared. They get scared, maybe it's cancer, because there is a lot of awareness about oral cancer. So if there is a small irritation in the mouth, immediately, madam, idu cancer enakku cancer varuma. That is called as cancerophobia. Okay, so these conditions patients do come with these conditions. And what we immediately do, we give them some topical anesthetic. Okay, and in severe cases, we have no other choice but we give our gold standard triamcinolone acetonide. So why don't we try aloe vera? There is literature, there is evidence which says, there is systematic reviews which says there is effectiveness of aloe vera in treating recurrent aphthous stomatitis. Okay, so you have the journal issue, everything. That is why I'm putting all my references with photographs, so that interested postgraduates, undergraduates, faculty can take up this as future research topics. Okay, so you can use aloe vera also. Now, in this article, a total of 1 or 2 articles were retrieved In that, 55 articles were screened, and they have proved that aloe vera can be used as an alternate treatment for recurrent after stomatitis. Okay, they have you can use it as an alternate treatment for recurrent after stomatitis. And if you see down, it is a very recent article. It is 2019, Journal of Pharmaceutical Sciences 2019. Okay, so now we have seen what are the effects of aloe vera. Now, clinical applicability of natural products. This is a general article. Clinical applicability of natural products for the prevention and treatment of oral mucositis. So, oral mucositis is seen in patients who are taking head and neck radiotherapy. If the oral cancer is somewhere in the head and neck region and they receive radiotherapy, oral mucositis is an unavoidable complication of this kind of radiotherapy, head and neck radiotherapy. In these patients, they come with severe burning. As it is, they are in distress because of cancer. Adding more wounds, they have severe oral mucositis, severe burning sensation, pain. Okay, all these things are adding more fuel to the fire. Okay, you want to relieve them of these kind of symptoms. What do? You go to your way back, you go to your English medicine, which are definitely associated with lot of side effects. And that is why they say corticosteroids are a double-edged sword. They are a double-edged sword. They will give you benefits as well as they will give you harmful effects and adverse effects. Okay, so why don't we look back at our roots? Why don't we go back to what our forefathers practiced? Why don't we go back to what our country is famous for? You see the authors, they are all foreign authors. They are working on natural systems of medicine. They are working on alternate medicine. They are working on ashwagandha. They are working on aloe vera. Why aren't we doing it? Why aren't we doing it? So wake up all of you and start looking back at our roots. And this is another systematic review and meta-analysis where it is comprised of a lot of natural products for oral mucositis. Okay, so next, the abstract of the article says they have studied and identified 151 articles. In that there are 47 RCTs or randomized controlled trials, and the results of the meta-analysis support a positive effect of honey and aloe vera. So this article has got both all systems of natural medicine, and in this they have used honey or normal honey and aloe vera in reducing oral mucositis in patients receiving cancer therapy. Okay. Next, this is another article where they have compared ginger and aloe vera mouthwash in patients with xerostomia. So all of you know, summer, all of us have xerostomia, but otherwise, other group of people who chronically suffer from xerostomia is patients with type 2 diabetes. Okay, patients with type 2 diabetes, you keep the mouth mirror on the buccal mucosa, it will stick. It will stick. What is that sign called? Any postgraduate would like to answer? Any postgraduate or undergraduate can answer. You can unmute yourself and answer. What is that sign? Am I audible?
Mouth mirror sticking sign.
What is the proper name, madam? Is it called mouth mirror sticking sign?
Mouth mirror sign.
Okay, it is called as mouth mirror sign. That is what you're saying. Okay. Then you have other signs like lipstick sign. Yes or no? And you have tongue blade sign. One more sign is tongue blade sign. So all this will stick to your oral mucosa because of decreased saliva. This is called as xerostomia. All of you know this. And it is very, very commonly seen in patients with type 2 diabetes. So they have done a clinical trial, which is a triple blind trial. You have different types of trial. One, single blind, double blind, triple blind. Triple blind is a very, very highly effective and a highly reliable trial. Okay. And they have done a triple blind trial where they have compared the effect of ginger and aloe vera mouthwash. And it is published in the Journal of Oral Medicine and Pathology. Sorry, Med Oral Pathology Circulation. Okay, it is a very, very famous journal. It is a PubMed index journal. It has got a very high impact factor and it is a very, very recent journal. It is 2021. And they have proved that patients who are taking aloe vera mouthwash have got decreased symptoms and severity related to xerostomia. Okay, so ginger and aloe vera mouthwash have significantly reduced all symptoms and severity related to xerostomia. Okay, so this is a very, very interesting article. Now you have another one which says effects of aloe vera and peppermint. Peppermint is nothing but your pudina. Pudina is known as peppermint. It is also the botanical name is veramin. Okay, the moisturizing gel of peppermint and aloe vera on mouth dryness and oral health among patients hospitalized in intensive care units. Okay, so they have taken patients who are in the intensive care unit or ICU. Okay, and they have done a randomized control trial, randomized placebo control trial. That means for some group of patients, they have given placebo. Placebo na adala onnume kedayadu. It is just like a drug. It is not a drug. For the other group, they have given aloe vera and peppermint mixture moisturizing gel, and they have seen the effects. Okay, they have seen the effects. And the effects are, they have showed that veramin moisturizing gel or peppermint and aloe vera moisturizing gel is effective in significantly relieving mouth dryness, preventing dental plaque formation, and improving oral health in patients in the ICU or the intensive care unit. I'm sure all of you will agree, maintaining oral hygiene in the intensive care unit is not very easy. It is very, very difficult because patients will be in the ICU for so many other life-threatening conditions. Okay, there maintaining oral hygiene or mouth dryness will take a secondary importance. In that case, we can use this to relieve their symptoms. Okay, as far as this program is going till now it's about 25 minutes I have entered into this lecture. Is it interesting? Can I have
Yes,
your
ma'am. It is
feedback?
interesting.
Ma'am.
Yes, ma'am.
All of you? Many
Yes,
people
ma'am.
can unmute. Only Pavitra, Dandapani and Sheikh are answering. Anybody else can unmute. You can tell me where to stop. You tell me if you need some extra explanation.
Yes, ma'am.
Are you comfortable?
Yes, ma'am. We are comfortable, ma'am.
You're able to understand?
Yes, ma'am. We are able to understand, ma'am.
Good, good. Okay. Shall I continue?
Yes, ma'am.
Okay, okay. So this is about aloe vera. So you've seen already I have quoted about 5 to 6 articles about aloe vera. Aloe vera is something which is very, very simple. It is usually neglected. It is usually ignored, but the medicinal effects of aloe vera are numerous. With one very important thing, it is not having any side effects or very, very minimal side effects. That is the importance of aloe vera. That is the importance of Indian system of medicine. That is the importance of alternate medicine. And that is the importance of going back to our roots. So let's turn back. Let's think back. Let's really sit and think about our own system of medicine, which originated thousands and thousands of years ago. During Shushruta's period itself, it was all available. But we have all forgotten that and we have gone towards the West. Next, we move on to turmeric. All of you know turmeric, it is called as curcumin. In Tamil, it is called as manjal. Okay, and this manjal is supposed to be very, very auspicious. That is why in all Hindu households, manjal is there for all pujas. Manjal is there for all festivals. Manjal is kept to the god. For Pongal, we keep manjal. Okay, we pray to the manjal. So manjal is something which is available in every household. All of us use it for the curries. All of us use it for the gravies. All of us use it for any kind of cooking, Indian cooking. Turmeric is an unavoidable ingredient. Okay, so let's move on to turmeric. I hope I have covered at least to some extent about aloe vera. I hope I have kindled your interest. See, my idea of today's lecture is I want to kindle the interest of youngsters about alternate medicine. I hope I have done it for aloe vera. So next we move on to curcumin. So all of you agree curcumin is the Indian golden spice. Okay. Curcumin is a bright yellow chemical produced by the plant with the biological name Curcuma longa. It's called as Curcuma longa. It comes under the family Zingiberaceae. This Zingiberaceae, we'll be talking about one more plant in Zingiberaceae, that is ginger. Your inji or ginger also belongs to Zingiberaceae. And they all come under the family Zingiberaceae, and even curcumin falls under that. It is the principal curcuminoid of turmeric. And it is a root. We are using only the root. In aloe vera, we are using the leaf. In curcumin, we are using the root for the therapeutic purpose. Okay. The history, I told you, when we go back to our medical literature, when we go back to our ancient literature, we see that Sanskrit medical treatises and Ayurvedic and Unani systems, turmeric has a long history of medicinal use in South Asia. Sushruta recommends, Sushruta you all know, is the first physician, ancient physician, Sushruta. He recommends an ointment containing turmeric to relieve poisoned food dating back to 250 BC. BC means before Christ. 250 BC munnadiye they have used manjal. And he's saying if the ointment has got manjal, it can even relieve the effects of food poisoning. That such is the antibacterial effect of manjal. Such is the antibacterial effect of manjal or curcuma longa. I'm sure oral medicine PGs, you all would know that we have got lot of antioxidant property also in manjal. I don't know if you can hear the video, but anyway, I'll play it. Just see, this is Veerapandiya Kattabomman video.
If audio is there,
Can you hear the audio?
no, doctor.
Okay, I don't know. I think this was just to distract you. So
Leave
this
it.
is all of, you can hear me now?
Yeah, fine.
Can you hear me? Can you hear me?
Yes.
You can continue, doctor.
Yeah, okay. Okay. So all of you know that was Veerapandiya Kattabomman, very
Now,
famous,
if audio contains
very famous Tamil movie where he talks to the British about whether they have done manjal அரைச்சு கொடுத்திருக்கீங்களா எங்க பொம்பளைங்களுக்கு அப்படின்னு கேக்குறாரு. So that is the small video. That was just to கேக்குதா? Dr. Sudhamani, can you? Shall I continue, Dr. Sudhamani?
Yeah, you can continue, ma'am. Now it's fine.
Okay. So this is another, all of you know, our grandmothers. Our mothers won't have done it. Our grandmothers, it is a custom to apply turmeric on the face, especially on Fridays and Tuesdays. வெள்ளிக்கிழமைனா மஞ்சள் தேய்ச்சி தலை குளிப்பாங்க. That is very, very famous in South India and very, very famous in Tamil Nadu. So now all that has stopped. We go to brightening turmeric lemon do-it-yourself face mask. This face mask will cost 1,000 rupees. And now on Amazon, it will cost 1,000 rupees. You use face pack here. It is nothing but just manjal. But that he will put it in all attractive tubes. He will give fancy names. And he will say your skin will become lighter in 1 week, in 1 month. So all the prospective brides will buy this. Okay. But please remember, all this was there since ancient times. Okay. All this was there since ancient times. You had our grandmothers using manjal on the face, especially on Fridays. Grandmothers will wash their hair, put manjal on their face and do puja. They will have a big red bindi. They will put manjal on the face, have long washed hair, and they will do puja. But now it has all changed. It has all changed. We go for turmeric face mask, very expensive, available on all e-commerce websites. Okay, and the rates are exorbitant. You will get all fancy names, but it is nothing but just manjal or turmeric or your curcuma longa. Okay. So with this bit, let us go into our oral lesions. Okay. So how has turmeric helped in our oral medicine? So you have a systematic review. Again, I am see most of in this entire presentation, it is about systematic review and meta-analysis. I have tried to use only the highest form of evidence so that all of you are aware that it is not just some child's play, or it is not that some grandmother's story or some old folk medicine. We are talking with lot of evidence-based literature. We are talking with lot of scientific literature. And this, interestingly, Karpagavalli madam, I think she's there in the Zoom. She has also authored it along with Dr. Margadavalli and Sri Devi Dharman and Dr. Shanmugam. Okay, so it is a systematic review and meta-analysis on the efficacy of curcumin and turmeric for the prevention and amelioration of radiotherapy or radiochemotherapy-induced oral mucositis in head and neck cancer. We saw aloe vera helped in oral mucositis. Now we are seeing our own curcumin, which is very much available, readily available. This is also helping in patients with radiation-induced mucositis. Okay, so this is from our very own known faculty from the Oral Medicine Tamil Nadu branch. Okay, so these are all authors are known to us, and they have done a systematic review and a meta-analysis to analyze the efficacy of this turmeric and how it reduces oral mucositis in head and neck cancer patients. Okay, now what did they do? The background is efficacy and of curcumin and turmeric. That was the aim. They have taken articles from 2010 to 2021. That is a 10-year search. Okay, and please see carefully. They have such all very, very good sites: PubMed, Cochrane Library, Google Scholar, Science Direct. Okay, and it is a 10-year search, and the results of the search, the meta-analysis of 5 prophylactic trials, favored curcumin turmeric in reducing severity of oral mucositis. And also, if you see the conclusion, they say I'm getting a disturbance. You can mute them, madam.
I will do it.
Okay, so curcumin turmeric is safe. If you see the conclusion, you can see that curcumin and turmeric are safe. The efficacy is high, well tolerated in preventing the delay in onset and severity of oral mucositis. As well, it has also ameliorated pain. What do you mean by ameliorated? It has reduced the pain in patients with cancer therapy induced oral mucositis. So they are strongly recommending novel curcumin formulations and high quality randomized trial to improve the therapeutic effects of curcumin. Okay, so this is a 10-year search, a very nice article published in a very, very good journal. We have another review article, which is again a systematic review on the effects of turmeric and curcumin on oral mucositis. This is also published only in 2018. It's a recent article, and patients treated with curcumin and turmeric reduced grade of mucositis, pain, erythema intensity, and ulcerative areas. So you can use this. Also, turmeric is being used in the management of oral submucous fibrosis. There is a systematic review and a meta-analysis, okay, which is published in 2020. And this article says there is positive response for turmeric usage in managing oral submucous fibrosis. Okay, so patients, if you want to try a comparative study, you want to try a cross-sectional study, you give the standard drug to one patient, you give curcumin to another patient, and you can see if the mouth opening and symptoms are improved. Okay. Next, we move on to honey. All of you know honey is nothing but teen. Tamil we say teen, and that too, the honey which is obtained from the deep forest is called as malathane, which is very, very famous. Okay. If there are forests, I think the Satyamangalam forest, is it close to Salem, Mettur, Salem, all those places, you get this pure, okay, pure malathane that is very, very famous. That is called as honey. What is propolis? Propolis is slightly different from honey. Propolis is a kind of a gum. It is a kind of a resin which this bees use for the hives. To make the hives stick together, they use this propolis. So propolis and honey, they basically have the same kind of properties. That is why I have combined both of them. Okay. So what is this? What are the medicinal properties of propolis? Propolis is nothing but bee glue. It is also called as bee glue. It's a resinous substance accumulated by the bees from different types of plants. They take different types of, the resinous substance from different plants and they put it in the hive so that each and every, that hive is adherent to each other. Otherwise the hive will break. So for that it uses this resinous substance. This propolis and its extracts have numerous applications in treating various diseases because like aloe vera and like your curcumin, they have antiseptic and anti-inflammatory, antioxidant, antibacterial, anti-mycotic, that is against fungal, anti-ulcer and anti-cancer and immunomodulatory properties. Please see how many properties it has got. Please see, it has got antiseptic, it has got anti-inflammatory, it has got antioxidant, antibacterial, antimycotic, antifungal, anti-ulcer, anti-cancer, and immunomodulatory properties. These are the great properties of your propolis. Okay. Now, how we are using propolis in our oral medicine? How you are using propolis here? It is used, we have got meta-analysis. Can you hear me?
Yes, ma'am.
You
You're
can
audible, ma'am.
clear, huh? Is it
Yes,
clear?
ma'am. Yes, ma'am.
Okay, okay. So we will go on to what are the effects. They have done a meta-analysis and randomized control trial for the efficacy of propolis mouthwash in cancer therapy-induced oral mucositis. Okay, so for cancer therapy-induced oral mucositis, they have used this propolis. Okay, they have prepared a mouthwash from the gum resinous substance and they've used propolis in patients with oral mucositis. Okay, what did they do? The literature, they searched 352 articles were identified and propolis mouthwash was seen to be effective and safe in the treatment of severe oral mucositis. Okay, so it has got an odds ratio of less than 1, 0.35. That means study is effective. Odds ratio is less than 0.1, it is effective. So propolis mouthwash is effective. They have done a systematic review and meta-analysis. They have seen odds ratio is just 0.35 and the p-value is 0.003, which is highly significant. And they have seen that the propolis mouthwash is very, very effective in the treatment of severe oral mucositis. And we just cannot throw this as saying this is some other article. No, they have done a RevMan search. They have done a proper systematic review. They have taken only randomized control trials and they have published it. You can all see the article. The journal details are given below in Vancouver format. You can utilize it for your further research. Next, another systematic review and meta-analysis, same thing, which I showed you before. They have got natural products in the treatment of recurrent after stomatitis. This is done by all foreign authors in the International Journal of Oral Dental Health 2019. So you can refer this also. So you can get a lot of information about how to reduce pain intensity and lesion size in recurrent after stomatitis in patients with low to moderate quality of evidence. They have conducted a randomized control trial and they have seen, they have taken patients with placebo, they have taken patients who have given 11 natural products and they have done a systematic review and they've seen that the intensity comes down. Okay. Another one is bee products and treatment of blister-like lesions around the mouth. You can use it even for herpes. Please listen carefully. You can use these bee products, honey and propolis even to treat herpes virus infection. Okay, so this article proves that it is from complementary therapies in medicine. They have done a systematic review using only Just Find system and they have seen that propolis is the best of all the natural possibilities in the treatment of herpetic skin lesions. Again, oral medicine, oral diagnosticians, we are seeing a lot of cases. Okay, even this hostilites will usually come just below the lip, just near the lip, they will get herpes labialis. They will get small vesicle lesions and it will be severely painful. If you take history, patient will say, Madam, 2 to 3 days back, I had high fever. I had body pain, I had malaise. Now I'm all right, but this lesion has come. So it is clearly a case of herpes labialis. So you can try propolis for these patients. Okay, you can try propolis for patients. What we usually do, we give herpes cream, which is nothing but topical acyclovir. We can give propolis cream and try. Okay. Is it clear till now? You can unmute and talk.
Yes, ma'am.
Is it interesting?
Yes, ma'am. Yes, ma'am.
Any doubts? I saw some questions in the chat box, which I will take it up at the end of the session. Other than that, do you have any questions?
Ma'am, there is a question from my end. Hello, ma'am.
Madam, can you please be a little clear?
Am I audible to you?
Yes.
Yeah, I'm Dr. Juhi from Zere Dental College, AMU.
Yeah.
I would like to know whether any method of standardization of these techniques, like whatever the aloe vera gel, how we supposed to use it, because whatever we are getting commercially, whether we can use it for the treatment.
Yeah,
Because that is the main
it's a
hurdle.
very good question. Juhi Gupta wants to know how aloe vera is administered. Am I right, madam?
Yeah.
Yeah. See, basically, none of these products can just be taken from the plant and applied. They all have to be pharmacologically and phytochemically synthesized. For that, you have to have a very strong school of pharmacy or pharmacy department. You can go to them with the key article. You can see how it has been synthesized, and they will make a formulation for it. That process is known as a formulation. Okay. Today, my presentation restricts only to what are the natural sources available. So you can find out what is available, and you can go to the pharmacies college or pharmacy department, and they will formulate this preparation for human use, and then you can use it. Okay.
Okay, because that is a hindrance, because I wanted to use it for many patients, but getting in that formulation.
Yeah, that is the primary objective of this presentation. You can take it up as dissertations, you can take it up as short studies, and you can go for formulations. You can go for formulations.
I need a collaboration with some
exactly. You don't have to go to a pharmacy company. You can go to school of pharmacy. Yeah, pharmacy department or school of pharmacy, which is basically dealing with formulations. Okay, they are preparing herbal mouthwash, etc., etc. So you can go to them with the basic ingredient. They will filter out. They will do a phytochemical study. That is beyond the scope of this presentation, because UGs are also there. That is why I didn't go into the details. That process is known as phytochemical screening. What is phytochemical screening? You screen the plant for particular phytochemicals. All plants do not have all the phytochemicals. Okay, so you go. Can you hear me?
Yeah, ma'am. You are audible to me.
Okay, so you can go to them and get a phytochemical screening done. Screen for alcohol, screen for polyphenolic compounds.
Yeah, because they have side effects. Those things need to be removed.
Do the toxicity. That is very important. Plant-based medicine has got a big disadvantage. Toxicity can be very high. Like suppose certain algae, you want to do some study with algae. Algae has got high toxicity. Okay. If you want to do a mushroom study, mushroom is basically a fungus. Fungus has got high toxicity. Sometimes it has got life-threatening toxicity. We can lose the patient. So first do a in vitro study, go to animal study, and take it up as a human trial. It's a long process, but a very interesting process. I can promise.
Okay, ma'am. One more thing. Do you have any idea about ashwagandha?
Ashwagandha is there in my presentation. If you can wait patiently for another 15 minutes, you will talk.
Okay, ma'am. Okay, ma'am. Please continue, ma'am.
Any other questions? I hope I've answered your questions, Dr. Juhi.
Yeah, ma'am. Very well.
Any suggestions from anybody? Any questions? I think only postgraduates are asking. Undergraduates can ask some questions. It's for you also. Any undergraduates want to ask anything? You have any doubts? Dr. Sudha, undergraduates are there?
Yeah, they are there, ma'am.
Okay. Shall I wait for them to unmute, or shall I proceed?
You can proceed, ma'am.
Okay. So next we move on to chamomile. Okay. Chamomile, I'm sure if you all go to 5-star hotels, it has become a very common thing. They will put 2 chamomile leaves in your green tea and give. Okay. And they will charge you 1,000 rupees for that green tea. Actually, this chamomile is grown in the kitchen gardens. It is grown everywhere. Okay. So chamomile, the common name is also chamomile. There is no particular Tamil name or particular local name for this. So chamomile, it is belonging to Camellia sinensis. That is the botanical name. Chamomile is one of the most ancient is one of the most ancient medicinal herbs. Okay, it is the member of Asteraceae compositae family. Okay, all these are a little tongue twisters. All the botanical names are tongue twisters. Okay, the dried flowers. Please remember, aloe vera we use the leaf, turmeric we use the root, and here we are going to use the flower. The flower of chamomile, it contains many terpenoids and flavonoids. My dear audience, please remember, whenever you have got flavonoids and terpenoids, that means it has got high antioxidant property. If somebody tells you this leaf has got high content of flavonoids, then please assume that it has got antioxidant activity. You can directly go to the pharmacy department with your leaf or with your product, and you can tell them, sir, this has got high antioxidant property. Please do a phytochemical screening and give me a product. I want to test for anti-cancer activity. You can go directly to any pharmacy person and tell, because flavonoids and terpenoids, they have got high anti-cancer activity. Okay. So this is the introduction about chamomile. This chamomile, it is known as Camellia sinensis. I told you that is a botanical name. They have used it as a mouthwash in oral care, and you have a systematic review which was very recently done in 2020 December. Okay, so let us go into the details of that. What have they done? The product is, they have tested for the antiseptic, antioxidative, and anti-inflammatory activities of Camellia sinensis or your chamomile. Okay, and they have taken 69 relevant studies, including 41 randomized controlled trials. Please see, all the evidence in my presentation are usually systematic review, randomized control trial, and meta-analysis, because I'm reimposing again that this is the highest form of research. Your case report, case series can be biased. It can just be published for the sake of publishing. But I have carefully chosen systematic reviews and randomized control trials and meta-analysis so that I give you the best form of evidence through my presentation. Okay, so we have 69 relevant studies which include 49 RCTs. They are generally proposing antimicrobial, anti-plaque, and analgesic indications of these tea formulation. So this they have formulated in the form of a tea. All of you drink tea. So this is chamomile tea. And considering the main trend in clinical evidence and favorable safety profile, Camellia sinensis are able to act as antiseptic, anti-plaque, and anti-inflammatory agents. Because it has got anti-plaque agent only, they have used it as a mouthwash. Okay, and it can be useful as a mouthwash in future clinical studies and practice. So any perio-PGs there, anybody wants to formulate a mouthwash, please don't forget chamomile. Okay, so chamomile quercetin, this is another species. They have done a randomized placebo-controlled trial, a double-blind trial of quercetin in the prevention and treatment of chemotherapy-induced oral mucositis. And we have seen certain very, very important observations that in 20 adult patients who underwent high-dose chemotherapy for hematologic malignancies like your leukemia and all those things, they have seen that mucositis was lower in the quercetin group compared to the placebo group. Okay. And next, efficacy and safety of topical chamomile in oral lichen planus. Please remember, lichen planus can be very, very irritating. It can cause severe burning sensation. Patient will be depressed. So you have to relieve the symptoms. And famous triamcinolone acetonide has got a lot of side effects. So we can try topical chamomile in these patients. Okay. And this was done in Cairo University, Africa. And they have found out that 2% chamomile cream can be used as a second line of treatment for patients with oral lichen planus. Okay. They have compared it with your triamcinolone acetonide. Okay. Next, we move to pomegranate. All of you know pomegranate, very, very famous. Okay. Madulai Param. Madulai is very, very famous, and it has got a rich red color. It has got a very, very rich red color. Please remember, anything which is colored has got high antioxidant property. It has got high antioxidant property. Similarly, our madulai or pomegranate has got high antioxidant property. But remember, Diabetics should be a little careful because it has got very high sugar levels. Your pomegranate has got very, very high sugar levels also. Okay. And pomegranate is a very, very commonly available fruit, and it is belonging to the family Lytheraceae. It has got an important antiviral also. It has got a very, very important antiviral action and antioxidant and anti-inflammatory action. And please remember, this has got a very strong antifungal action. Pomegranate juice can be used in management of candida. Pomegranate juice can be used in management of candida. So this is a hint for those students who wish to do a study on fungal infections. Why don't you take two groups? You give one the standard antifungal. You give one the standard pomegranate juice, extract of pomegranate. Let us see how the colony forming units are reduced. Okay, so you can do an in vitro study, slowly take it to animal trial and slowly take it to a human trial. Okay, so pomegranate juice is very, very commonly available fruit, and the juice from this plants have got significant antifungal property. Okay, and it has also got tannins and polyphenols, which indicate that it has got a strong antioxidant effect. Okay, so it has got high phenolic content. And please remember, those patients who are hypertensive, patients who have got high blood pressure, this pomegranate can prevent formation of atherosclerotic plaques in the coronary arteries, in the heart, the arteries of the heart. Okay, and it has got anti-tumorigenic effect. That is why I say it has got antioxidant effect. We have a review article published by two Japanese or Chinese, I don't know the names, looks like Japanese or Chinese. It's a phytotherapy in the management of denture stomatitis. Okay, denture stomatitis, all of you know, it is a kind of a fungal infection caused by candida. There is a systematic review and meta-analysis and randomized control trial. They have proved the importance of this pomegranate as an antifungal effect. So this is the details of the study. I have put all the studies below as a footnote, so all of the interested people can take screenshots and you can do a study. Okay, and this Punica granatum or your pomegranate, okay, they have compared Punica granatum, propolis, and your ginger, okay, and they've seen that animal study showing some antifungal, promising antifungal bioactivity. Okay, so that completes pomegranate, and we've got two more herbs to complete this presentation. The second from the last is tea tree oil. This is very, very easily available. It is available on Amazon. It is available on your e-commerce website, Amazon. And this tea tree oil is called Melaleuca alternifolia. Okay. And I want to tell you, I have guided a student who has done a study to find out the efficacy between tea tree oil and a standard antifungal medication. And she has seen promising results with tea tree oil. I'll show you the title of the dissertation also. Okay. So tea tree oil belongs to the family Myrtaceae. It is composed of terpenes. Remember, terpenes are there, monoterpenes are there, and it has got alcohol. So it has got strong antifungal and antioxidant property. Okay. So this tea tree oil, the efficacy of alcohol-based, alcohol-free the solution for the treatment of fluconazole refractory oropharyngeal candidiasis in patients with AIDS. Please see the title very carefully, my dear audience. It is efficacy of alcohol-based and alcohol-free Melaleuca, that is nothing but your tea tree oil, in the treatment of fluconazole refractory. That means fluconazole is a very, very strong antifungal medication, but this oropharyngeal candidiasis is refractory to even that, but that has been treated with your tea tree oil. And that too in whom? Patients who are highly immunocompromised, that is your patients with AIDS. I hope you can understand the gravity of this title. Is it understood? Can I get some feedback from the postgraduates? You're all awake?
Yes, ma'am.
Okay. So can you please see, fluconazole is a very, very commonly used, very famous, highly potent antifungal. But this oropharyngeal candidiasis in HIV patients is even refractory to that. That means despite using that, it has come again, and that has been treated with your tea tree oil. Such is the fungal effect of this tea tree oil. So this is the same thing. This is the details of the article where this is what I was talking. I have guided a dissertation where the student has done effect of 0.1% tea tree oil oral rinse, and she has compared it to 1% topical clotrimazole. Topical clotrimazole is a standard antifungal agent for which we usually give. So she has done a comparative study, and she has also seen the histopathological behavior of oral candidiasis. It was a comparative study, and she did this study under my guidance, and it was shown, the results of the study is that tea tree oil was equivalent in efficacy compared to 1% clotrimazole. Okay, so this is the study from our university, Sri Balaji Vidyapith. And next, we move on to the common ingredient, which we all use in our rasam. Okay, we all like poondu rasam, poondu kolambu, poondu kara kolambu. We use so many things. Okay, so garlic or Allium sativa is the botanical name for garlic. It is very commonly used. Okay, and it has got numerous medicinal properties. Okay, so this is it belongs to the family Amaryllidaceae, and it is known to contain a lot of antioxidants. And please remember, it is very, very good for the heart. The garlic or your Allium sativa is very, very good for the heart, and the flavonoids in garlic have got antiviral property. Especially during this COVID time, many people, what they do in the early morning on an empty stomach, they will boil garlic in water and they will drink that water. They will keep it for some time. Once the garlic juice gets in, they will drink that water. Okay, it has got a strong antiviral property. Okay, and it has got other things which has got antibacterial property also. So they have done many systematic reviews, just like the entire presentation, where they have showed that traditional plants with antioxidant properties in that Allium sativa or your garlic has got an important thing. Okay, just like your curcuma longa. Okay, so I don't want to go into the details of this. And the last one we're going to see today is ashwagandha. Dr. Juhi Gupta asked about ashwagandha, so this is for her. Okay, so it is known as Withania somnifera. The botanical name is Withania somnifera. Okay, ashwagandha is being used for a lot of ailments. Okay, so it belongs to the family Solanaceae, and it is commonly called as ashwagandha or Indian ginseng or winter cherry. Okay, the decoction and extracts of the herb shows immunomodulatory activity. It is showed that these activity is similar to steroids. Sometimes they call ashwagandha as natural steroids. Okay, it has got such a high immunomodulatory and anti-inflammatory property. And water effect extract of ashwagandha leaves has got anti-cancer activity and identification of an active component and its mechanism of action. So I think this will answer Dr. Juhi's question. You have to go and find out the active ingredient. You will have hundreds and hundreds of phytochemicals. The exact term is called secondary metabolites. You will have hundreds and hundreds of secondary metabolites, and only the pharmacist can do a phytochemical extraction, and they will tell you which is the active ingredient, which can be used and which cannot be used. Okay, so have they done? Dr. Juhi?
Yeah, ma'am.
Not clear. Can you hear?
Wait, ma'am.
Your ashwagandha has come.
Yeah, I can. I will just unmute myself first.
Okay. So,
yeah, I can
ashwagandha.
hear you. Yeah. Ma'am,
Yeah,
I'm
sorry,
audible?
I didn't hear you.
No, I'm.
Yeah.
You are very clear. I'm listening to the presentation.
Can I go ahead?
Yeah, ma'am.
Okay. So next we move on to ginger. This is the last herb. See, actually the presentation, they have given me time slot of 1 hour, 1.5 hours. But if you want to talk about alternate medicine, you need 2 to 3 days. Okay. So that is not possible in one presentation. So I have taken only the important things. There are a lot of other things which you can ask, you can converse with me. I will share my email ID at the end of the presentation so we can interact. And I'm not saying I'm a master's in alternate medicine. I've just begun my PhD and it is related to alternate medicine. And it is something which interested me. I felt it was out of the box. So I took up this topic. So you're all free to raise your questions. I'm also learning. I'm walking along with you. So you can share your views. You may be experts in some part. You can also teach me that. And with that, we go on to ginger. This is the last herb for today's presentation. And for those who are bored with my presentation will finish in another 10-15 minutes. So we move on to ginger. It is known as Zingiber officinalis. I told you it belongs to the category of turmeric or curcuma longa. Okay, I told you it belongs to the family Zingiberaceae, which we saw in curcuma. It is cultivated through rhizomes and grows very well in the tropical and subtropical areas. And just like all our previous medicinal herbs and shrubs, this is also has anti-inflammatory property and a very strong anti-inflammatory property. It has inflammatory mediators such as prostaglandins, which act on enzyme cyclooxygenase 1 and 2. Okay, so this also has anti-inflammatory properties, and having ginger with all our food is very, very advisable and very, very good. Okay, so this is another, I don't know, Japanese or Chinese article. There's effects of Zingiber officinalis in the membranes on minor recurrent aphthous stomatitis, a randomized pragmatic trial. Pragmatic means practical. It's a practical trial, and it is from the Journal of Traditional Chinese Medicine. I want to tell you, apart from Indians, Chinese are also very, 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 they consider alternate medicine as a very, very important form of medicine. Okay. And here they have used dried ginger rhizome membrane, and they have seen that patients are relieved with recurrent aphthous stomatitis by reducing this TNF alpha, etc., etc., etc. Okay. So these are the details of the studies. So this is the audio, and again, it's not going to play anyway. It was just to distract you people. And I just wanted to tell you about my post-grad PhD. I'm pursuing my PhD right now, and I'm formulating a herbal mouthwash. I cannot disclose the name of the herb right now because the novelty will be thing. I have gone personally to the fields. This is myself in the scorching hot, and my guide has asked me to collect the leaves. So this is myself collecting the leaves. And I have come to the pharmacy department, and first I have cleaned the leaves. Now I'm doing maceration procedure. Okay. So this is to just kindle your interest. This is not to show off or anything like that. This is just to kindle your interest that we can do formulations from herbs. I myself am doing it. I have gone to the fields. I have got the herbs. I am trying to do the formulation, and it has just started now. I've been very well guided by principal of School of Pharmacy, which is also a constituent college of our University, Sri Balaji Vidyapeeth, Dr. Sharat Chandran. So he has motivated me, and the process has started. So I would just like to tell all of you that it's time we go back to our roots. It's time we think about what alternate medicine is, and just at least spare some time in doing some research projects. With this, I conclude my presentation. I hope I have not bored you. I hope I have not keep bragging about myself. And I just thank the entire team of Vivekananda Dental College for MIBIM for giving me this opportunity, especially the management, the Dean and Advisor, Professor Gokul, Principal Sir, Professor Balan, Organizing Secretary, Dr. Sudhamani, the Faculty of Oral Medicine and Radiology, especially Babu Sir, Babu Suseraj Sir. I thank you all for giving me this platform to share the little bit of knowledge I have on alternate medicine. For feedback and further queries, this is my email ID. You can mail me your queries. Please just let me know your name, your institute, and what is your query. You can also send me your feedbacks. It will be a kind of a motivation for me. I'll feel good. My serotonins will go a little high. So that is I think that is the lecture. And we have come to the end of the lecture. I hope I have at least tried to answer some of your questions. Anybody wants to ask anything, you can unmute yourself and ask. You can send me your feedbacks on my mail ID. You can even send me your queries. I'm just taking baby steps in alternate medicine. So I'm still a learner. I'm working with all of you. So if possible, I can answer. Otherwise, at least I can search literature and answer. So any of you have any queries? Otherwise, it's over to Dr. Sudha.
Ma'am, I'm Dr. Deepa Das.
Yes.
I'm really happy that you have pursued such a research topic and did a presentation also. I really encourage all the postgraduate students also to do such research But whatever happens, research shouldn't remain in your thesis. It should, I think everything should be made commercially available. Ma'am, I was the first PG, perhaps in 1997, 98, to have started research in turmeric. I made capsules with curcumin and also compared it with turmeric oil in oral submucous fibrosis. So
good.
very happy to see you presenting such a topic, ma'am. Congratulations and all the best to you.
Thank you. Thank you so much.
And hello, ma'am. It's Dr. Jagat here. I am parallel with Dr. Deepa Das, and whatever she just mentioned was something which I experienced with her. I'm her parallel PG from Ramchandra. I hope she remembers me. And she was the first one to do curcumin, and we were, in line with her research for quite some time. Thank you for being a part of this, madam. It's Dr. Jagat here.
Thank you, sir. Thank you so much.
Any other questions? I encourage the undergraduates to ask some questions. Dr. Sudha? No, I mean, don't force them because they're too small for this. It's okay.
There are few questions in the chat box, ma'am. Shall I read that?
Yeah, please read. Please read. Please read.
Are there any standardization regarding the dosage, mode of application, and duration of application of the aloe vera gel, specifically for lichen planus, OSMF, and aphthous stomatitis? Or it is the same for all conditions, ma'am?
Okay. So first of all, it is not going to be the same for all the conditions. The dose has to be fixed. If they are already commercially available aloe vera gels, you can consult, you can bring it to the doctor, show it to them, and then take the medication. All the three conditions which you told, which will not have the same dosage, because all of you know the severity and the pathophysiology in each one is different. So the dosage is not going to be the same. But if you're going to formulate a specific aloe vera gel, then you have to fix the dose, seeing the anti-inflammatory, antimicrobial property.
Thank you, ma'am. The next question is, there are many brands available for aloe vera gel. So for topical application, ma'am. So can we use the same for intraoral lesions also, ma'am?
Yeah, you can use it. What you can use dermatologically, you cannot use. What you're using for the skin, you cannot use intraorally. It has to be done under the guidance of the doctor. All those creams which we can use on the skin dermatologically cannot be directly used without doctor's consultation intraorally.
Yes, ma'am. Thank you, ma'am. The next question is, in case of corticosteroids, we know the molecular structure and the site of molecular structure and the site of molecule which is responsible for the anti-inflammatory action. So in case of aloe vera, turmeric and honey, is the mechanism of action is same on that is based on molecular structure, ma'am?
Yeah, actually aloe vera, turmeric, everything have got anti-inflammatory property. And most of these drugs, they act by blocking the enzyme cyclooxygenase. All of you know cyclooxygenase is needed for inflammation. But we cannot say the mechanism of action is just the same. It will have slight differences. That is why we say not these things are only, this presentation only says these things are having this property and these trials have been done. To take a particular herb or to take a particular plant and do further phytochemical screening, see for its anti-inflammatory property, is for the researchers to be done.
Yes, ma'am. Thank you, ma'am. Ma'am, next the question is, what is the release kinetics difference between the whole turmeric and the ingredient separation release, ma'am?
Sorry, can you repeat?
What is the release kinetics difference between whole turmeric and ingredient separation release?
Whole turmeric cannot be used, madam. You cannot use whole turmeric as such. Okay. So the release kinetics difference will be there between whole turmeric and individual ingredients. Okay. Whole turmeric means you're including even the skin. Okay. So you have to do sectioning, you have to do phytochemical screening, and then only you can see the release kinetics.
The last question is there any contraindications and side effects for alternative therapies, ma'am?
Alternate therapy, actually I put a video for that. It was a comedy video, but the video didn't play. Anyway, see, anything we tell no in Tamil. Amrudamo adigamana vishamayidum. Amrudamo adigamana adu vishamna. So anything taken over a particular level, it can be poisonous. Okay. And I'm again warning everybody in the audience that these plants can be toxic also. That is why toxicology studies, toxicity screening should be done before administration. So side effects can be there. Some people will develop rash. Some people, but it is something very easily, it can be treated. That kind of side effects will have usually in plant-based medicine. But you can have certain life-threatening side effects also, like some mushrooms are highly poisonous. They can even kill the patient. So you have to be very, very careful before giving it to the patient. You should do proper phytochemical screening, proper toxicological studies, and then go for administration. That is why we have 3 levels of research. First is you are having a in vitro study, then you are going for animal study, then you are going for a human trial. Only after that you can administer.
Yes, ma'am. Can you please suggest the trade name for aloe vera and turmeric for intraoral use, ma'am?
Alox is there. There is a gel called as Alox.
Yes, ma'am.
And curcumin, you have so many. Dr. Deepa Das herself has done some curcumax or something. Dr. Deepa, you want to add anything? You have done no curcumax.
Yes, ma'am. Actually, curcumin, somebody had asked whether whole turmeric is effective or not. Actually, I started by asking patients only to grind turmeric at their home and then apply it. I have used it for leukoplakia, lichen planus, as well as oral submucous fibrosis.
Okay.
But when they started using it, what the problem is, it was not very effective. At the same time, it used to stain their mouth as well as their clothes, everything. Okay. So then actually I like madam said, I had inquired with a pharmacologist, and he was the one who prepared it for me as capsules as well as turmeric oil. The capsules are easy for the patient to use. It is very
it is available as curcumax. Yeah,
yes, correct. By Livelong Pharmaceuticals, but there are a lot of companies now.
Yeah, now there are a lot of companies. That is what I'm telling.
It has become commercially available.
Tell trade names in the presentation. It is not ethical also. I cannot suggest. But please, there are a lot of trade names available. You can search, no problem.
Another thing, madam, which I would like to suggest is you always do a histopathological study. I had done a histopathological study also between different grades of oral submucous fibrosis.
Yeah, and I showed my student's thesis. She also did a histopathological correlation.
Yes. And I found that the mitotic fibers as well as the inflammatory component plus were reduced. At the same time, vascularity was also improved. No, turmeric as such is not absorbable in the intestine, you know. So you have to add piperine to make it absorbable. So whatever is commercially available is along with piperine.
Okay.
Curcumin as such is not absorbable. That is why. Thank you, ma'am.
Ma'am, the next question: when using alternative medicine for OSMF, lichen planus, do we use as adjuvant or as a primary treatment, ma'am?
Yeah, this is a very good question. See, actually, when patient is having severe symptoms, okay, we cannot go for alternate medicine. Please remember all these things: Ayurveda, Siddha, Unani, homeopathy. They will give change very, very slowly. But English medicine or your allopathy will give instant relief. So, in severe conditions, you cannot use natural medicine. Only for milder symptoms, or to prevent the symptoms from becoming severe, you can go for alternate medicine.
Yes, ma'am. Ma'am, for curcumin oil and tablets, are there any trade names, ma'am?
Yeah, she told you, no, curcumax.
Okay, ma'am.
I cannot tell the trade name in the presentation, madam. It is not correct. So I'm stopping myself from using trade names here.
Yes, ma'am. Thank you, ma'am. The questions are over, ma'am. So thank you very much, ma'am, for your valuable information regarding alternate medicine and oral lesion. It will definitely help us in future. All these valuable insights gave us a new perspective that one should accept while discussing these oral mucosal lesion management. Thank you so much, ma'am. I would like to call Dr. Yasmin Ahmed Sir, Associate Professor, to present the certificate of appreciation to the speaker of the session, Dr. Vandana ma'am.
Good afternoon to one and all. Ma'am, it was a very good, excellent presentation, ma'am. Thank you for enlightening us on alternative medicine. I find this to be a timely presentation, ma'am, actually. So, as we are into a era of waves of pandemics, as we say in Tamil, "Alaigal oyuvudillai," like it is a situation like that. So, alternative medicines have gained importance or significance during these difficult times. Many times, rather being an alternative medicine, this has been a mainstay of treatment, actually. So, today's presentation was a strong emphasis on the point. Thank you for enlightening us, ma'am. I'm glad to issue the certificate of appreciation.
Thank you. Thank you, Yasmin. Thank you so much. Dr. Sudha?
Yes, ma'am.
Yeah, thank you so much for giving me this opportunity.
Yeah,
And
yeah.
convey my thanks to Babu sir and
Babu sir is eagerly waiting to thank you. 1 minute.
I now request Dr. Babu Susai Raj Sir, to Associate Professor, to propose the vote of thanks, ma'am.
Good afternoon, everyone. Honorable Speaker Dr. Vandana and respected delegates and all the participants. It is my great pleasure. I got the opportunity to thank all the delegates on this grand occasion. On behalf of the Women Department BDCW, the privilege of thanking and expressing my sincere gratitude to first of all to respected Dean Sir Dr. Govinathan for allowing us to do the CD program, and next to my gratitude to our principal and HOD of our department, Dr. Balan Sir, for standing with us on all the occasions. And I would like to thank Dr. Vandana to accept our invitation and find time to amidst a busy schedule to grace the event. And thank you for making a wonderful presentation, Dr. Vandana. It was a nice, wonderful experience and lot of new innovations and inventions in the alternative medicine field. It was actually a lot of enlightening and good experience for me also in the field of alternative medicine. As Dr. Yasmin rightly said, these sort of times, the need of the hour is alternate medicines also. They also play a great role, and it was a wonderful presentation. Thanks a lot, Dr. Vandana Madam. I must thank our organizing team and the volunteers for working out for past 1 week to make this CD program a successful one. And I also thank the technical team for arranging the auditorium and making it possible for the UG students and all the others to attend. Again, thanks a lot, one and all, from Department of OMR, BDCW. Thank you, one and all. Bye.
Thank you.
Thank you, ma'am. Thank you, sir.
Thank you so much. Can I leave the meeting?
Yes, ma'am. Once again, I thank you so much, ma'am.
Thank you, sir.
Few more